I wanted to ask about MSH. Do you think there's or have you seen a correlation between people's ability to raise their MSH and treating the tick-borne infections? Is this something that can hinder that ability, or have you seen cases where, despite having, confirmation of an infection, they can still raise their MSH to reasonable levels?
So, um, in my experience, the primary reason for low MSH is marcons,
Okay.
and and so if you fix the marcons, in most cases, that's going to contribute to the MSH coming up. If you have an infection now that shows up, and that's causing, say, an elevated MMP9, maybe C4A. Any of the cytokines can be up from the infections as well.
Right.
These are not specific markers for mold, right? This is where it gets, experience helps in working with what you see. But these markers, so if you have elevated cytokines and you have a cytokine storm, even if the marcons are gone, is that somehow influencing regulatory hormone production with a brain on fire?
Yeah.
I think it's very possible. So I haven't actually looked at that issue, so I wouldn't be comfortable saying with certainty or numbers, but in theory, it makes sense. I always talk about and people talk about putting the fire out, and if you put the fire out, then the brain can heal, and when the brain heals, then it does a better job at making these hormones.
Right. And we do have some, right, from the research that the data that we looked at, we have some evidence, right, so we showed that seems to be a negative correlation between MMP9 and MSH. So if you have very high MMP9, MSH levels tend to be low, but that correlation was very specific to people who had confirmed histamine elevation. And from that perspective, right, if the infection is driving that cytokine storm, or if it is one of the big contributors, because there could be probably a combination of the environment and the infection,
Right.
then I could see how that could get on the way of raising MSH. And even if you do raise MSH uh, levels with high MMP9, you may not be raising it. You may not be hitting your ceiling because of that piece. So maybe
Right.
you get it to 21, 22, 23, and you're excited, but you have a tick-borne infection, and it may be that once you get that out of the picture and the cytokine storms fully cease, you even get another boost of MSH potentially.
Yes.
Um, so yeah, that is an interesting piece to think about it. I would imagine though that yeah, I agree 100%. Getting out of exposure and then marcons, if it's
Mm.
present, those seem to be it. If you don't address those, even addressing the tick-borne infection, it doesn't seem like it would pan out for MSH restoration.
Right.
So those things need to be in place.